Hello everyone, my name is Robert. I am a nursing student from Nightingale College. Today I will be performing a video skill drawing up insulin. Before I get started, just want to point out that I do have my school ID. I'm also wearing my school uniform as well. Since I have hand sanitizer here, I'm going to go ahead and use that before I get started on my skill. Now, first thing I need to do first is compare the physician's order against the electronic health records, and I will also compare the physician's orders against the medication administration record, the MAR. What I'm looking for when I say compare and what I'm checking for is I'm checking for the 6 rights of medication pass. And what that is going to be the right patient, the right medication, the right dosage, the right route, the right time, and the right documentation. The right documentation would always come last after you're done giving the medication. Even if the patient refused, you want to document that as well. Also communicate with the doctor. So the physician's order says that I'm to give 4 units of regular insulin, short acting. That will be combined with 8 units of NPH, into one NPH, the intermediate insulin. That is going to be combined into 1 syringe at a total of 12 units of insulin that I will be giving or administering to the patient. So now that I check the physician's orders and everything looks good on the MAR, everything looks good on the electronic health records and the physician's orders, they all share the same information, I will go ahead and go to the med cart now. I'm going to be pulling the insulin from either the med cart or if it's in the refrigerator, wherever it is being stored. Pull it from the refrigerator, from the med cart, bring it, check it. I'm going to compare. Actually, once I get the insulin, I'm going to be doing 3 checks of the 6 checks, meaning that I'm going to be checking it 3 times, making sure that for this situation, it's going to be safe for the patient, right? So now that I got it, I'm going to do the first check. I'm checking the insulin against the electronic health record. Checking the insulin against the medication administration record. And the 6 rights are correct. That's good. But be mindful that when you go and get the insulin, when you first get it, you want to always make sure that there's, check the expirational date on both bottles. You want to also check to see if it is at room temperature. You want to make sure it's ready to be given at room temperature. Also, you want to check the content of what's in the bottle, making sure that the medication is in its original form, meaning that it hasn't changed colors. Even though the expiration date may say a later time, you still want to make sure it's been properly stored. So you don't want to see, like for example, say like if it's supposed to be like a cloudy white but it's brown, that's an issue, right? You want to also look at the content, making sure that the medication is not clumpy, making sure it hasn't been compromised also by precipitation from the refrigerator. So, you want to do those safety checks to ensure this medication is actually safe to give. Don't just give it because it's in the bottle, right? So now that I've done my 6 rights with that, this is considered the first check. I'm going to gather my items, go into the patient's room, introduce myself, and tell him why I'm there. Right? So I have my gloves, I have my syringe, and I have my insulin and my alcohol swabs. Now I'm going to go knock on the patient's door. Hello, Mr. Jones. Hi, my name is Robert. I'm a nursing student from Nightingale College. The reason why I'm here is that there's a doctor's order for you to have insulin, right? Your lunch will be here in the next 30 to 40 minutes. So we want to make sure that we give you this insulin on time for it to be working for you. Okay. So give me a moment. I'm going to go ahead and put these items down. I'll go and provide you some privacy. Then I'll wash my hands. Put your items down on a clean, dry surface. There. Then I'll go ahead and pull the curtains. Provide the patient some privacy. Go wash my hands at the sink. Okay. Now that my hand's clean, I can actually go and touch the patient now. Mr. Jones, can I please check your wristband, and as I'm checking your wristband, can you please verbalize your name and your birthday for me, please? Okay, your name is Raymond Jones, birthday March 10th, 1965. Thank you, Mr. Jones. As I explained, I'm here to give you insulin. So before we actually do that, I'm going to first check your blood sugar. So I'm checking Mr. Jones' glucose level. Check those, right? It's at 168. So yeah, we're going to actually give you that insulin. But now that I got his name, his birthday, and I verified his ID, I'm going to now do my second check of medication administration safety checks. Now, with that information from him, with the insulin, medication, and I'm going to confirm everything with the medication administration records, making sure the 6 rights are there. That's right patient, right medication, right dose, right route, right time, right documentation. Now that I confirmed that, also be mindful, because I just checked his insulin, his glucose level, I'm going to also check to make sure to see if there's an order for a sliding scale, meaning that if his insulin is at, if his blood sugar level, glucose levels are up too high, certain patients may have an order for a sliding scale to actually not just to give the regular, but also the regular routine insulin, but also to give a different type of insulin to actually even out that patient's insulin levels or glucose level. So Mr. Jones does not have a sliding scale. So now I'm going to go back and talk to Mr. Jones. Mr. Jones, do you have any allergies at all? Are you allergic to any foods? Are you allergic to seasonal? Do you have any seasonal allergies? Are you allergic to any medication? No, Mr. Jones confirmed he does not have any allergies. So for the 2 insulins that I'm going to be giving you, the regular insulin, you're going to receive 4 units of the regular insulin. This is the short-acting insulin. Is what I would explain to him what the short-acting is. So what the mechanism of action for this medication is that it's going to actually draw glucose from your blood and into your cells to be used as energy to lower your glucose level. The half-life for this medication should provide you enough or the needed amount of insulin about 30 to 60 minutes before your meals, right? The contraindication of this medication, it includes hypoglycemia. We will not give you this medication if you have hypoglycemia, or if you had an allergic reaction or some form of hypersensitivity to this particular insulin. We will not give that to you. There are adverse reactions that we would like you to inform us of, or there's also side effects we would like you to let us know if you're feeling any of those symptoms. As far as the side effects, common side effects include like you're going to have like an irritation on the site where you receive, or skin irritation on the site where you actually do the injection. So it's always good for that reason to rotate wherever you give yourself an injection. Try to like change it around so that you don't just keep beating up on that same area, right? Just to minimize the skin irritation. Hypokalemia is also a side effect. Arrhythmia, and I think I did mention skin irritation. Now, if you have any of those side effects, please let us know as soon as possible. Adverse reactions include you may feel a tingling sensation around your lips. Seizures is actually an adverse reaction, and also tachycardia. If you feel symptoms of any of those, we need you to let us know as soon as possible. Do you have any questions at all? No? Okay. So after I went over the first insulin, now I'll go over the NPH with Mr. Jones. I would explain to Mr. Jones that the NPH, although it has the same mechanism of action as far as to lower the glucose level, I would explain to Mr. Jones that this one will last longer into his system, maybe last a little bit more, like maybe half the day. I would also explain to Mr. Jones the side effects of this medication, which includes also skin irritations for the side effects. Also, I would say water retention and weight gain as far as the side effects. There's also adverse reactions we would like Mr. Jones to be aware of, meaning that it could be, let's just say, confusion, generalized weakness, or headaches is what we need to be mindful of as far as the adverse reactions. Do you have any questions about this medication? No? Okay. So for that reason, I'm going to go ahead and prep this medication. So I already checked the medication earlier as far as making sure that it's safe, right? Meaning that the color hasn't been compromised, the content hasn't been compromised, the expiration date, everything is good. So as I said, it has to be at room temperature, but we also want to mix this medication. So what we don't want to do is we don't want to shake the bottle up. We're going to let me first put my gloves on. Let me do hand sanitizer, clean my hands. Clean my hands. Hands are clean, right? And now that my hands have been hand hygiene as far as with the hand sanitizer, I'm going to go ahead and put my gloves on. And we are going to first mix the medications. As I mentioned earlier, we are not going to be shaking the bottles. So I'm going to start by just putting it in my hands and just rolling that medication just to mix it, right? But not going to be aggressive with it. We're just going to mix it around, right? Just mixing it by rolling it in our hands. Put that down. Also, we're going to mix it, same one with the regular insulin. We're going to mix that. Now, it's important that I did it this way, right? After I mix it, Then I want to wipe off the tops of this. See, I don't want to do that backwards, right? So once we wipe off the top, then the next step is to make sure that the syringe go into. We don't want to cross-contaminate. So I'm going to open up this alcohol. I'm going to wipe off the top of the MPH. Throw away the alcohol swab. Now I'm going to open up the other alcohol swab. I'm going to wipe off the top of the regular insulin. Throw that also in the trash. Now I'm going to get my insulin safe safety syringe, right? But the cap's still on. The top is still on. I'm going to first draw up 8 units of insulin. I'm sorry, 8 units of air. And I do have another nurse here. You're probably wondering why she's here. She's actually here as a safety verification to do a double check, right? A new set of eyes. So she's going to verify that we're following the physician's orders and doing everything by the book, right? According to the physician's orders. So I just pulled up 8 units of air, right? 8 units of air. I'm going to let her see that. She's going to check it against, we are going to check it against the medication administration records. Now, from there, I'm going to also let you, the team on the other side of the camera, check the amount that I pulled up, right? So that's 8 units of air, right? I'm going to remove the cap. And this 8 units of air is actually going to go right into the bottle of the MPH. I'm going to press on the syringe, inject the 8 units of air. Then from there, I will actually pull in 4 units. 4 units of air this time, right? 4 units. And I'm going to show her 4 units of air. Good. We're going to check against the electronic health, the medication administration records, 4 units of air. Now I'm going to also show you 4 units of air. Good. Now, this time I'm going to inject 4 units of air. Right, and this time inject the 4 units of air. Now I'm going to invert, flip the bottle. Now I'm going to actually pull in 4 units of medication, right? So as I pull in 4 units of medication. Now what's different on this procedure is we want to, actually I'm going to show her first the 4 units of medication. This is for the regular insulin, 4 units of regular insulin. We're going to pull this out of the bottle. And we're going to tap on it to make sure that there is no bubbles. Good, there's no bubbles in there. So I'm going to actually show you those units as well. So you can see, right? 4 units, right? Let me make sure you can see that there. Okay, 4 units. Good. All right. Now, we're going to check it against the medication administration records, making sure that the 4 units are proper. The nurse confirmed it. I confirmed it. Now, on this part, we want to make sure that we put the syringe into the MPH, and we are going to make sure that we invert, and we are not going to press on the actual syringe because we don't want to mix it. And now we're going to pull in at least 8 units this time, making it a total of 10. Good, that's right on the dot. Making it a total of 10. And we want to remove the syringe before we tap it for bubbles, because we don't want the medication to go back into that bottle, right? We want to tap it after we remove the bottle or remove the syringe. She's going to verify that it's 4 units. I'm sorry, that is 8 units, making it a total of 12 units. I'm going to show that to you guys, right? A total of 8 units, making it 12, right? Now we're going to check it against the electronic health records. I'm sorry, we're going to check it against the medication administration records. But before I go any further, what I need to do is I'm going to do the 1-hand scoop to make sure that I can, good, and put that on, because I still need to prep the patient for this for this injection. So if I was to prepare this medication outside of the patient's room, first thing I would do is I would make sure that I label that syringe and bring it in. I'll label it with the patient's name and the medication and the dosage amount, right? So I'll give the injection, but to speed it up, let's say I give the injection, I did my hand hygiene, or I cleaned up the patient's room, did my hand hygiene, and then I would go and document the scale. Thank you very much.